All right, so we are there. Good evening, everyone. We are just waiting for some few minutes for our presenters to be on, and we will start this live stream session today, being the second time we are doing this series on Coronata that is dedicated to sensitization on COVID-19 in the various languages. To all of you that are joining us, to all of you that are watching, those on Facebook Live and those also in YouTube, we want to say you are most welcome to this series. And today, obviously, we have very, very dynamic people. As you can see, all of them, one looking very, very much like Aku. And obviously, she will speak the Aku language today to all the Aku listeners. And the other one, Isaac, can you say a word? We just want your face to come up and pop up.
Hi, good evening, everybody.
Yeah, John, so you can see he has a typical Karolinka look. All right, so he's, yeah, he's going to speak Karolinka. For some reason, we have issues having a Manjago with us, but we will obviously have the Manjagos to come on board. Dr. Peter was supposed to present, but we had some little bit of challenges. But again, before the end, it's going to be sorted. It's going to be sorted out. So we'll just take some little bit of time as we go on, and we will start it very soon. So guys, I'm gonna just share my screen, and you know we're gonna start straight away, right? Okay, I was saying that we want to welcome the Vicente that have just joined us for this live stream. You're most welcome, Vicente.
Thank you very much, Doctor. Thank you.
Can we hear you?
Thank you very much. Are you getting me now? Let me unmask myself. Maybe that will be better.
Yeah.
All right.
All right.
Are you getting me now?
Yes, we can hear you.
Right. I just want to thank Dr. Isaac Jabang and Dr. Harris Green on board for the moment.
She's Margot Green Harris.
Oh, Margot Green Harris instead of Harris Green.
Yes, please.
Thank you, man.
Okay. So I'm going to share my screen and then we're going to start the program straight away. There we go. So fellow Gambians and everyone that is watching this program or listening to this program, we are most honored to invite you to the Coronata series. And we are still on episode 1, where we want to talk about what coronavirus disease is in general. And today we are privileged to have with us languages that will be presented on today's presentation. We want to say that you need to watch out for today's series and this weekend series, the weekend series that is going to start today, followed by the series on Saturday, the last series that is going to be on Sunday. Just to say that episode 1 started last Sunday with presentations in Mandinka, Wolof, and Fula, or Harpular. Today is the other version of episode 1 that we would see hopefully later. And today the presenters would be, presentations would be in Aku, in Manjago, and in Karoninka. We're going to have the doctors that are going to present, and we will see them as follows. The panelists are myself, I'm the host and moderator, John N. Jabang, and I want to welcome you most especially to this session. Dr. Margot Green Harris is going to present to us today in Aku. She's a house officer at the Edward Francis Small Teaching Hospital. Dr. Peter T. Mendy, who we will try to see, he's had some little bit of issues with his connection, but we will try to see. We may not have him, but technically he was supposed to present the Manjago version. However, we would be able to get somebody before the close of the day to be able to help us go through the Manjago version. I don't want to be punished by my Manjagos, so I'll try to ensure that somebody is around to present. Dr. Isaac Jabang, he's going to be the Karoninka presenter, and he's a medical officer at the Edward Francis Small Teaching Hospital, and he will do the Karoninka presentation. Dr. Isaac Jabang, you are most welcome to this presentation. So for your information, the Zoom ID is there, 84844887266, and the passcode is 614053. Those of you who want to go to YouTube Live, you can go to my YouTube channel, or you can just type Dr. John N. Jabang, MD, Dr. John N. Jabang, MD in YouTube. You should see us on YouTube Live or on Facebook Live. So just want to say that coming up is going to be Sarahule, Jola, and Serer, episode 1, Saturday, tomorrow, and episode 2 will start on Sunday with Mandinka, Wolof, and Fuller. Having said that, I just want us to have some little bit of time and see if we can get something to entertain ourselves. Don't know why it is done. Just a second. We want to entertain ourselves. Okay. Okay, for some reason we can have it here. Okay, all right. So we'll get that, we'll sort that out. We wanted to bring to your attention the Coronata song, which is a very beautiful, indeed beautiful song. Let's see if we can get it. We still can. Okay. Okay, so without much ado, I just want to hand over the discussion to Dr. Margot Green Harris, who would present to us in Aku. Dr. Harris, you're most welcome.
Good evening, Dr. Jabang. Good evening, me company doctor them where they na today. And good evening, me family them where they listen to me. Doctor, I want to tell you thank you before I start for where you take your time for organize this program here. So for where we go before talk to we family them about this sickness here, we don't disturb you all. Kaboya, me family them. This series here na corona ta denking column. Na in Maninga word, we mean to say corona don't can at all. And as I say, we all know everybody sickness here say it don't can at all. It don't unbog we all. It don't disturb we all in one way or the other. So today I want to make we keep comping about this sickness here. So for make we sabi waiting at this sickness, our man able for sabi say get this sickness, our man go able for do you know go forget her. And if you do we still able forget. Corona na a sickness where you sabi say it can fever fresh. It can affect what in the English man can call the respiratory system. When are the part of the body where you sabi say now we can take in a breeze and pull breeze back through the nose. Now a virus we can call SARS-CoV-2. Now this can cause this sickness here so. The other name wey dem can call am na COVID-19. They can call am so because man sabi body sickness here so na 2019. The sickness not now it begin last year. And it begin na China. But as we all don sabi now, non sign of fire again. The sickness don't come Africa, and it don't come Gambia back. Now it make we almost must sabi this sickness here so, and we almost talk about this sickness here so. The sickness hard for differentiate from fresh cold. But in pass mark, it can pass fresh cold. If person get them, it can forget fresh cold, the body can warm, it can get it hard, you know, can for breathe. Don't even normal activity self, the person not can for do it again. As they like it today, over 25 million people in the world don't get this sickness here so. And about 18 million don't get their body back after they get this sickness. But unfortunately, over 8,000 person panel we join panel we get this sickness here so not able for make and they end up for die. We neighbor Senegal, about 13,000 of them person them get this sickness here so. 9,000 don't get well body after they get this sickness, and about 200 don't die. When we come back now we don't tongue win a Gambia, about 3,000 person don't get this sickness here. And this, then doctor then nurses them, then already work now then say person forget well body, they all join the back. About 1,000 of them when we don't get this sickness here, don't get well body today. But unfortunately, about 99% when we don't get this sickness here, so end up for die. How man able for sabi say he get this sickness here so? If in body warm, if he dey cough but you know they pulpit, if he ate at or in body they at, if in belly they run, or the person they vomit, or nothing no but taste na him, or the person not able eat, or the person not able smell safe, then person if person get them kind thing here so, it good for make the person look back himself because it possible say he get this sickness here so. As we all sabi, we all different. Some man can get this sickness, they know they get non-symptom. Some man can get them, they can get symptom them, but you know, but disturb them so much. Then when we know get symptom, then they can call asymptomatic patients them. Then when we can get them, but you know, but hamburg them boku, then they can call mild symptoms. And then mild symptoms here, which include your body can warm, it can get within fever like sore throat, in nose can run water, in body it can cough back, but the cough you know but get pit. We get one way they can call moderate symptom. We say it can unbug them, but you know but unbug them better. And then where the body can warm back, then can cough, then can get sore throat, the nose they run water, they're not able to sleep because they can just the cough, especially in the net, they're not able to eat back, so they can easily get tired. And it can even pass this thing can stay with them for within past 2 weeks. We get that one way in the severe state. Then if apart from that thing where I mentioned, you can see say their face and their mouth can turn blue. But since we're a black man, it got difficult for make we see blue. But if you look the person good one, and you sabi the person, you go sabi say in face and in mouth, the color don't change. It don't dark pass how in usual self. And sometimes it can tell say the person not there with the aid. The person can confuse. It can go to but sabi usa ide, or then think we can talk, or then think we can do. Just like where we can see if them person gets cerebral malaria, which we can call cerebral malaria, something like a that back, able for do the person. We get what we can call critical stage. And then why then require inpatient care. They must be in a hospital. Sometimes it can go till they can need ICU care. Sometimes it can go where they can need some surgical intervention. Then we will go for help them for make them breathe, because they can get problem then for breathe. This why another one we say then don't tie up on the sickness. They're not able again. The sickness don't go na the blood. It don't travel na the body. Which we can call sepsis na medicine. Sometimes they back the person in different organs the way can say now come together for make person we can they work differently. It for the organ they back. Now you make this critical state here. We know about joke with them. We can make sure say then they no hospital, we give them all the care where they need because they're able for die na this particular state. If person get this sickness here so, it a cough, it will spread them from one person to another. Now you make where person get this sickness here so, if I be mindful, if it a cough, the person for cover a mouth. If it a sneeze back, it for cover a mouth. If you sabi say you not feel well, you not get well body, it better make you not go on a treat, it better make you not go on a do. It good for make you stay in or sit down one place so that you know go for you go help your neighbor them, make themselves to not forget this sickness here. So if person that they sing, especially even if the person they sing, it they near you, it able for pass them because now then small which in English man call respiratory droplets. Then small thing we can come out if man they talk, if man they cough, if man they sneeze, then thing we can come out from his mouth and his nose. It able for travel meet your neighbor and give him back the sickness. If especially if that person they not protect himself, you know wear face masks, you back self to not wear face mask. This thing yana can make this the sickness spread. And if you come back to hospital, then because of the term everything they can call airborne, it go for day in the air. We for service say if you not wear mask or you not protect yourself, you will forget this sickness here back. So how we for do for protect yourself? We for always the wash we hand with soap and water. We for avoid then place where you sabi say boku person can do like a them pulnado, like a them bearing, like a them married. We sabi say boku person then they get that day and they know they protect themselves, they know they wear mask before they avoid them thing day. If you for come out back, make we make sure say we wear mask because the add for children on us sometimes the man can get thing them for go run it tranga for dinner us you know come out you get for see but then already na us but if you for come out make we make sure say we wear we mask make we make sure say we cover we mouth where we dey cough make we make sure say we cover we, at least if you not use we hand we use we elbow or we use with tissue if you feel to say we know they feel well do ya at the big una make we always make sure say we stay in our home. I hope say maybe anything we have forget during the time for the conversation, I go add and day. Thank you, Dr. Jabang.
Dr. Margot Green Harris, thank you,
Yes, sir.
thank you so much.
Now we join us, sir.
I never really knew you could speak Aku so fluently that you've been able to rattle this whole thing within a very short period of time. Thank you so much, and the message is clear. The message is clear. You see these symptoms, make sure you report them. Let us make sure we practice social distancing, physical distancing. Let us make sure we wash our hands regularly. Let us make sure we put on our mask when we go out. And also ensure that any other person you are dealing with, make sure the person puts on his mask. And I think that message is very, 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 very clear. And thank you so much. We are going to move in a bit of reverse order. Dr. Isaac Jabang. We will have to have Dr. Isaac Jabang to come on board to give us the presentation in Karolinka. Lupakan ang kalonia fiyo katumpu lompo nalu ku ati coronavirus. Anyinalu Dr. Isaac Jabang agna fa ufani alu floi hilimha. Isaac ni wananu.
Dr. John Jabang Njuananu abaraka fang yang kan fano budo via programme di pakanna pakembe kalon fio jing kijanalu ano ane alon pano panayen tu dunia ya kalon teman kem kale Gambi kem kati bidang Amerika UK pano panen tiga sidin tinggi konfan Dr. John Jabang na so ke fan king kaso Dr. Isaac Jabang di lomba Dr. Pimi te pehin bandi so fio kyo ki buku bada konfa uyum na dinga fa ku di aku no so kalonia lomba kanyang te e kato person kato ko di wade no ma fi ka kunyuka ano wan kyo kane si yo sin kyo kane dunia pano pan kyo kane kato am sinjan mana ngalon mana ngafula ma ngi at boduna en barande pena embe no so buku bat fio ka kunyanga me kane meme chumbagan fika subati radio and television yani in panopan kagunya ngasoka COVID-19 so Dr. John Jabang na chono nuli kadu ku kubot kuye serious na sokyo corona da group mantingai egnening pachide pucholio tepani kagunya ke pachide pecholi di dunia nasin jana hichumbagan kita ka virus yang pakan ke kita ka kuye meni feneni pani wai kulon be mening nuna me fo fu yang kan fangon na fo fakate yo e fe yang kan na member so ka kunyu ka so COVID-19 virus et name virus len kere sek nane ne ofanga kunyenge bajan ka so SARS-CoV-2 ka kunya gon kuchoko dijumpakan kususin kuchok bono dum susi bi kan pasu ngotale comme na wala na gol comme ni ane daga piket comme na fanda fa piket wara fa nga so fresh school anta comme petit application ngut warante apun ke humal fiep lon jaw why even though kana wala na ko ni fresh school ka kunyenge hanga comme kayo kan pambaka dina nada ka fresh school tempo no so fio ku ko bad ko anjuk anno na mi kama sire manyang na nyang kasinjan wa jandek na anno na mi bu mena nyang fongo tankande timpada ka kunyenge anjuk ka do fakalo so ka kunyenge ji mandingeni 2019 ngienti banka sopa China di bang sadeng ka sopa Wuhan so pongi digile go full ka do virus ye di bulugule ne no hinu lege fe e fuli di bulugule pa e begin e na koti anno fie e mande yanya po ka kunyo geni China ka pe ke di November December di chiman o fie pano kwantu dunia nkiem banko banken chemene fio ngati kasu ninga kunyenge ngati pojide tango jumpakan pakai di ka kunyenge so kisi tamasren puja mane ini karang kapsinjang ka kunyika fang umen ku full time kit gata ke am ngaisan ni jumpe tango ngu full kom di ni an ninji kuba kom fanyi fadigo ki mi fajam e mamuno ma ning virus yatingi after ka go ni fikna ko ni mu fajam mu kay to man warante ni andi ci suma warante ni wala na ngame no ko de ki humal so ka ki humal warante de ko warante de ci sum mu fajma men kir sem fiaw tempo mu nut mu kay ta ke no mana so mu ta warante me de kutu mo warante me de no virus a fone kay ti to an so after fear bayri ku jama comme fanje soge fa comme nana daga man piket fanje fa ka kunyi ko piket bana daga ko fon ko jo nu notification link ka kunyi ke men link yo kana ko dunia na sinjana tu dunia fi plon chao hanga hampa kan ke ka for 6 million a winning sak ke daga ka kunyi ke 6 million a winning sak why na sinjana lo berada pakan ke men ka daga for 6 million kat si hoje ba men kada ka kunyenge wa in ka fisak fula do kada pa kan ke men kada si ke men sag si hoje men pinam ke men ni lo po to ko neto be men ka kira ke ko kunyenge na sinjana pa kan ke ka fo pulo han million yono ke de ko kunyenge men ka kunyu ke men ke yo kan dunia ke ngamia lo po ni ngate kamuka hichumpa kan why ngade kamu kal way lon punu me yan ne dani man wane tay ka kunyu kala ma faket ani comme nas nyana kom fan justo fati dunia dara pakan ba men million kat si hoji ba men kada ka kunyu ga way fie ka fisa ka ketoti ka kunyu ga nas nyana Senegal dara pakan ba men fo suri ngasu wan si hoji keta ka kunyu nge di jumbi lombo ngafak way fo fie dara pa men ka kera ke di ka kunyu nge le Gambia le because una itumbuna lanka sogla ka kunyenge ke tubabu la mahani tempo nembe ka san ninka kunyenge panopan kiem nga dunia fi plonja nga Senegal nga le lompo Gambia niama Gambia siku hukan mun pakan ke ka fo si wuli si hoji karada ka kunyenge nda kolombo pakan ke lo hane fo lo han wuli fi ka men ka fisa karada ka kunyega wa nga fisa wa tada pakan pangameni almost pakan keme pangame gani ni Eduardo tiga kunyenge kakera tiga kunyenge memen tiga gober ka fi ake apa mi manfa ke pa anno warande badingo kete tiku so ku emeni kana kon dunia te unyanga pu una pulun posing ya ka kunyanga ngameni pankena ke fa dunia tamanta una fu pulun chaw ko chokta anno wana bihin ba wana nyungo hindu ku yanga kanola etega ba Figin kon ne himoko te kayo kan pakanna. Nada ka kunye ke tamasre men enda. Amerika kunyo ka kunyo nke na piyo. Pata tamasre ba fu sinjan en ba fu jokteni ni. Ngai san ning hijumpakan. Ngada ka kunye ke comme enini ne socially comme na fanta fama piquet waran tak malaria eni ne nyande bi so chut na li ka fiem sinja waran de li go te ka bi fi ni eni no pesoa fula paso en dia lompo page pago hini fenin kompamon na ta ka malaria kom hini ka kilan fi anka e go banga so ka chills so page pago eni ne socially page banga ta ko meni kom eni ne kilan chills fula o suboge o page pago ifika ka human wa ka human nge ko fando ni fresco ya fana fa ka human jama ka huma ka flina to wa just ka huma ke so jalama tiba wan ka so kwa dry cough fula do page pago ifika no ka pasenya ni hani ka hindua eni ne nyane pesen pct ka we 40 word pano pana lige eni pasenya ni page pago ngata kan apa ni kaw yanu jumpa kan lompo ngata ka kunyuga comme nga jonga hangan fie man man churai warante spray fie edika si hawa edika ini so bonin le man ha fotiem le warante hawa yesume kadu ga kunyo ngo chogo nin po o man dini ijogo pasongo dalo warante abini pambe wa ko hangel tembo weme pa ga ko jogelo ba hanin kanan mi champano tu hile lo fi edika mi mananga mi champano warante ange sokolo na chuka tamasiro e fi plon chaw ti wate e fi tade mi rol ku meni maybe man atata corona virus pa ke pa kolombo ku ya e jokanti la matu sus pa ke pa ko ngata kom kono bay fi warante enini en hade e wano kom na ninga fluna man hi chumpite ni ne fanju fe ni ne pakati fe jayi tamasiro fi plon chaw ku chuka ju ku si pa te pakan ni atata virus e so nous le faisons pas especially kalon katika me ekene min ko kunyi kenke ano wane ta nimpa pamba fangata ano wantom nacho monomo page pa ngata ka ko itika isen ta masiro fande ni de sowi itika ta ka ngapa ni kawo itika me fala ni kada da ka kunyuka wa inka hina test kapiopi tambo ngasinjan ngaso gini virus ya tawe tempo nancho page pa ko ngada pa kayo haji ba kaso ni le man senye warande wa huye medical kan why virus ya pa ko lang hangala ba ci de ne pa kan kay ninga kay ni fofi warande ni hambodi ni warande pa ke da ki ga kunyu nga fan pa kan virus ya so tempo na pana pour comme le gambe ni kan ni ka kunyu ka nga yo family ti fi plon ci warande ke ko le kan o ka do pa ke pa ko be ninga da ka kunyu ka idi ga symptoms na no so asymptomatic cases mun fula do groupe sube de ne penga mene fa da ka kunyu ka why idika isen ku emene efe yo kani nema ko warande ku emene efe hintani ide nuka kunyu ke ngai feke kat ide buka bahin warande ku efe plonjo so pa ngai ne atom category warande kaptaga tamasiro diga banga da fia pasen ngai paso weni fe chain ki lamma diga banga fe ni fresco ngata ke ko ni pendo e pinenya isu ju chain king ning pa banga da kanga ban hikaw pakai pa nka sikana wa ke man temuna warande wa we finde warande sukulo warande mchempano idike ni sokoni ami mchempano warande ange sukulo ka do ke nan do ino omwa to ekna no sok mild cases so e joge jogia kanga meni kata ko symptoms kata kama siro kai ko wa we kani asymptomatic cases pa su bien pa ka kan keda ka kompanyo pa ni flying king man pasoweni preschool fia kanga panikao ninga sekana wa idika meaning ang mam tempal warande sokolo inta groupe hojenu penga meni pako kata ko kunyi na ki chain ki yo kani chain ki ang kayo kanti kapang yo kani pake pako penga ni soka fia pako after kini eni ne fesu chut na ma pa na ngai pesifia to after ko man ni ne so mem ke pat ne na poli no boni ka kekelan kom na ta kamali de fang fa ini fa ka kekelan fia pakolon pengada kom ke human after inga ke hum ada after ke hum wa ke hum nga ko fadni ke fresco ke hum nga ke huma ko fdena ndo wa kom ke hum ke suja fiala ma paga pa on kata pasenye ni pe fakat ke hinutu wa nga ka hinde ka kai to hin wa eni ni pano pana like eni ni ope yonye ope senye tamas kata paga kata fie kom sinin sas nebe pujo warande sa de kom na daga free school fan jukfa paga pa nka se kana kom fan so fan man kana awa hilu fi diga mi so ni wa fe nu no yam warande man mi jampa no warande so lo warande fe lo jaw paga pa pusu si le de fe ni kom ane chotie warande ane hitie warande pu de fe ni wa ngana ngi pusu si diga ini no pidal te ko tak pusu si paga pa diga ini ngodo ngaka ngodo kangoto hanan piset yani fi ini ngodo paga pa ko fia hani wan kanen kelon bi no man kayok na juga kuye peta masere fi mane especially ni makataga kuye ne ni pako e pe kay no kuye no slogo susubo onyanga kamilo ni maybe o man coronavirus na taga groupe pa kile ne conference e jogia kada kan do sindem supi nak ne okani fe chain ke la ma waide ki di hin jena ne okani ham so moderate cases then pa kile ne eknem severe cases eknem ni ko kunyu ngara kina ko mema nga kunyu mema ngata ka kunyu ke de pako jama eni ne han paso e penga ni so gafi plon chaw why we supi ne pako paso mo da pam pio kan yo kan so nga defenen ane hiti adeke ni ka so mo edege ni ka so no after oman obahini ayok api ni struggle pour ka so mo paga pa ngata pasen mundo pasen pusus pasen puson fi plon chaw paga pa go nga hindia pike pa njiti me makpuru kapiyo paga pa ko pike pa de ni ka ko pusoni kom fanga ko fa pujo ko warande pakali kadinol kom fan ni me fa pujo pa ti pakan ke pa na chumuri ko wani amati etiba bo fi afu ni nas ngana hilelu fo ni jabti fe ni wa we fule ka to ko oxygen nyanga pa kaiti enini bay de ga pa ci de ka songo de ka eknane yokan member inta eke groupe anu seka critical case eknani ko kuni ka hintani hindan yokan groupe ye ko ka cholti lockdown ka hintani ka to ko jama fo ko wasi oxygen warante ege ku fere de hine nenda mi flaket tempo on pakan kanyo de mango tenu tempo ne ka kunye gena visa ko ta ku physical lockdown pikebu na ni budu mbap na karo ko sempe tempo ay nim fat so payenge ngata petite kasungut kargo para so bigane na kya ne jok pasungut ali warante ini warante wow so kidneys liba person libe ne fo liga kunyu me te jumpakan pi groupe ye ngalom lo me why na visa pa kay lokan ke bang ka wasiti masinya pe nga ne di kasungut warante ka wasiti oxygen ne ang kan so ka kunya ka puman ka tostan ka ka dake kom fanjin so ka tim fati gero kom fanjin be go fi after ma fati ma ka fanjal de plon jaw ka kuni ka tomu fati to fanja warante na sungota ti pasungota le mo fiam particle centers ngai so to ban ka so ka droplets or aerosols ka kuni ka no pongini ni kom na ti huma yo droplets kol ane da ko ka kuni o mo ne na da ka kuni warante na njingi huma fi table ye inken likyo ara akena likyo na likuso na likutumo ka kunyo ngini ko dosto so tempo ande ku jama medin fi plonje enje fi kelante yo ko fu nya info na tankande ku e mening e fe yanga na pour ku e fi plonje planga tempo ne wade fi pano panan site nga so ko kata ko kay fi helpa especially wona kalon fulunde ko kay kalon fulunde ko kay wengo because nimba mbaka chonchola hani an ono na ta ko coronavirus afrika fa au fan ano wane mto ko apata ka kunyuga to wengo do felom fi plon jaw na so ga ni ko ne kay ke ngod warande kay pano pan warande kulli warande manyo bido fi plon jaw o nyanga yokuno fi anchu kadu hina fong na tankani especially nyambo nya pakatuna pike pa we no ana mena fontinke to ko ni ne mingu to we take yo kan fi amema why nawe kaya apita ki ko inteno ti papa de warante nyeri warante mama Afrique mfano ka kunyuka akana enino yango fa amema nake so na plon cha umilola kuya kusoni so tempo ande ukata pa program ba ekna hilem hono isupen ho na so ga fulute no waso maskede wa meni ko putumi no ko sini anjuk nano wana ku ba fongo fiao no kaya pan pa marse ku meni de hinbaye nuna ka to on kudla fi lu angola e fe yanga na tumpo daga ga kunyuka e ge ko na so ka ke humfia nata ko tisu pepa e mina fi hum to you want ponol na so ke hum inde hum fiati epesi na ki humale na pa ya nganyo epesi wara na so ka tisu lombo in mono wate ko so ka so andimpa fan an epes ula ngola andimpa ngonol andimpa chukol fi ko chaw kan kan ganuna anchuk ka tu inia hifakoti coronavirus e handi hanan soge lompo ni ma awa funding ke warande aju ga pata masrempe dukare hinkata a pulen lengen fangi na fe no ti ke warande yebla mini ate ke ti pampaga fota fi hintesedi apmi manata kada manata ko e fe yankanga na una mema so hinem ha Dr. John den ji fi le hanho fol anju nuno kiati ka pika ke di ka kanol kan kanya hanol ka anji hangin tempe seto so anone da ka kan na ini na aponi ko anju nunu ukiotom section enki hangi hini ne kilem Dr. John tinya hano hinem
Dr. Isaac Jabang aso kyo hili mesum bisa ki timpa Dr. Isaac Jabang e hana so apa ya hili mafie pulung ke kunyu nim kitna kitudio uni paenka me kani pudum palom popuna uni lompo kame lompo kan Kristu om ke kunyu na bana pur katumpu ke lompo nuku palom nim pakatuna ano wan lompo katimpa si ano wan lompo na siten Dr. Isaac Jabang na so hali fioi apa fioi hidima meya meni ke kunyu ke katut ano wan puson anu tagada fana pakan paenka meni kalon paenka meni ke kunyu ke kicok bagai paga sukan desan ke pulo puto kolompo ni woto ano wan payem to ke kunyan kameni ke kunyi kitiponi anu kikeyo keile nuna yang kanunda fanguna ke kunyuka efikila ko na mema banuna yang kanana fanguna ke kunyuka efikila ko na fiao mema we just want to take a little bit of an interlude and I just want to see if it is possible to get you the our song, a nice song over here, and I just want to say thanks to Favor and her team for really composing this song for us. So kindly allow me a second. Let me just share my screen as we listen to this song. And immediately after this song, we will be having Dr. Armando Correa, who is joining us. And he would do the presentation for us in Manjago. Coronata is the title of our song. And Favor and team, I want to say thank you all so much. So let's see if it's possible. If we can play it, then okay. So I'm sure we'll get it on the next one because it's telling me we can't play this video over here. All right. So just a second. I would get to you. Okay. So just a second, let's see. I go again, I'll share my screen and I'll try to see what's can we
manke ferang manke talenti musa santi munga sang adama dingola musa santi munga sang adama dingola corona wala minti coronavirus ikonya corona wala minti coronavirus ikonya corona wala minti coronavirus alngabai corona wala minti coronavirus yankar jawona sasabe siyari sayare siyari chocho be siyari mol be silari woto wal ngasi suokono bihari tenye banto alinganda murani mbeta bantoto alingambulo kun safuna diola lite yake samba nimpate yake lamin nimpate yake corona me bandale lite yake samba nimpate yake fatu ni lami yake corona me bandale corona time wala minti corona virus jankar jola corona time wala minti corona virus ikonya di corona time wala minti corona virus alngabai corona time wala minti corona virus jankar jola.
All right. Thank you so much. Today we do not have it, but then we will have their description on our YouTube channel so that people can also go and support Favor and her team for the good work that they've been doing. So without much ado, we're going to go straight to the Manjago presentation, and I think we have here Dr. Armando Correa. If you are in, Dr. Armando Correa, please, you are most welcome. By Tinji Manjaku, achi program Corona, abukin Dr. Armando Correa, karo presentation di Manjaku. Okay, Dr. Correa, you are most welcome. I think I still remember some bit of my Manjago. Yeah.
Yes, thank you very much, Dr. Jabang. I hope you are getting me. Hello, Jabang. Bitagaleng bamba itinji. Tinji Dr. Correa. In the corona. Hello.
We can get you, Dr. Correa. Yeah.
Yes. Tinji Dr. Correa. Kachini in the corona. Cheap man company to check. Jikumundu bling. Punya pemal jaga corona tu kontawe. Aci corona pan kicing kan kicing pun kerwa corona virus na English. Te pemal ucimte ko joti pun dia June na di 2019. Unci rulo nucha di China. One gampun jaga COVID-19. Ji corona virus China di unci 2000 na kwas no lo. Uchim dem kumagpe we pajote China pajaram pajo kumundu tun konta pakabut te dem pichar pabut nyan kabut tu fut nyan char wan ni chela kuin kapur pakap magpe ma chim dem bur magpe patu be bandi tu chak nyatu chiti gam yati pachi reports uchim te legi ngak ko pindu mi ngak nang sin tu tu bana bang kai ke put na uchim tem banya majate ke tu magpe Cibana pibanya taja kuas nolo na banya pare kita lagi bici yang taja kuas nolo na banya kuas nolo banya kita tun kunta pemak mentembu tu caku niki jai butu ci Senegal kabut pemak ucim tentu mundu lagi kacing milion ni banya banya kita kap pemak na ucin yang kap pemak undi yang kemiru yang kap pemak aka ko impi ba tulia umagu chimte achikon na nam kum uri te uri jenu jotum kalo nya ka risk rich joto kalom balon jot tulungling balon bu chakadi uliyat ko mika utu ba pe pot sa ko yep fand ka nuran don kalom balon te pandalo tante ka pintan te ba pintan kan ka mak na ka puru jurar ma chimten te unor na market uliyat nyana achum façon balon ci ba megi gun gi jeki ci bu asymptomatic ba me ki tija te pibana to ko to le iti puma ki mari ka pibango diga pibango ko mu diga cha ulia furi kayika tem diga cha ma cha tum to le te ko pur na balon ji ba me ko tin puma ki mari ka fo sama kari ka fo za tu pur ko tija de uri ko tin ulia ki kanin ko din te ka lo ulia fun ne te kanora ma balon diga ka pidan ko kidam de ko diga te wal tem balon ga ci bu do me ka pe po za to ko uya fund ka jo tukuno rambo boka kanduri uya fund ka tukuno rambo ko te buko chan uya kruyeka balon chiba me ko chara boka ka ko me on ka jo pneumonia di bijin ba me ko uya fund ka jo tukuno rambo buko cha uya kruyeka na to uya kruyeka na ron ka jo tino ruwata balon ka chiba me uya fund tuko uya fund kanu rambo ma kana puru juraro ko buka ya fund balon chiba me ki foku ka tuwa magna chitwa ka polo pia chumba nyamba meki libira ko kete o chinga tembu de pamaga pi kanya ko corona dinya ka polo ka pamaga be dinya polo ka chum kom nya yi chelar o chimo ko nya na yi chelar me nya yi chelar akamli ko me kai tufu tamli ko ma nya fun do bol mu jeje mo ne akro an kum tem ne kran bis abur punya le ka pamaga ganja ka pin corona uga ga tuye ma wulari nyam no chimo nya kanya nam nyo par kanya no ros ko fetaro ne kanya nam ti uro ga kanya nam tam ne bis na kanya ngum na ne chimo ndam ko pian ko walon ga ci chinya ma la na kira ko ne pute ka na te na pa kanya no tu kanya no me ti ne pulum manang pulum ka tang pulum no karo na kira ko ana ba to ko mu da nyawa mun tu kanya no kira na tu pulur pian ko ma to ci bo kiro bo ros na balon pu charo pi chalan ko puro na ko bilin tu ka tembo to balon butu chibut me puri pu kira po nyana ka nyana me ka pu di kata me parin te fo ko lo ten da ka bu ros to en kom ku ros ko ti ka mas tu puri pu chibut ko kuri pu ka ka tembo da ko chin mga kamu balong ang iputo ne plim pan ko ne bukan tino par me bu kanya pemeki bukan bu prima tino ta nem kran nem nyotinya kran kan kini nyotinya bu kama tem bu tin tem kom ko da ne se ti benya jikati ne to ko bunyana ne to ko bujuli te bu to ko kam bu ne rostu bu ka tefti ko lo le pan ne yang to ko ne bre kambo karyan kane benim puri pichi butul tek puri rut ka kap ma ko pari wala kanya nanya ndi kanya ko o kra ko o nya ga ni chila pam te vat ko ren ko klar na banya ten du la nya ko puru kap ma ko o chim ga gam tem butul ma di nyam ko puru rom lang ko ti cha di nda ko puru putu ma ko nda kai prevention ko ma ko chu de ka bertia dia to ko buji kra ko am bak nyawnya nem bulang nyangkanya nem burang kamu nyangkanya kembak nyokanya punya kemyat lon ko ambani fok nyonya tina punya dikato jaga kaga tu ko jaga mas won ni kina grosto kina ko ndo ne kinu rosto nenya to pi chalarnya nenya yi chalato ka ko kimje ko kina ko to rosto ko pur pa ay na ko kaga jam ka ko kina kin grosto tin bulan ba ka to kini ko ne ko pasara ko ka kapuna na ngi picin kan ma ko me buta ko je dilit ma ko cin ka ko me ka ko kan tu ya ni ban di ba tiya te afrika ku in daga pur ko ko ma ga to ka jaba ma dinga ma ta dr jaba ma fiar ma linganta
Yeah, we can hear you.
oh, okay I think I'll pause there for a moment and
Korea.
I summarize it so yes
Okay, Mpari ra.
mamba man linganta
Okay, I'm sorry that there was a lot of there's some bit of vibration, but I think we can hear most of the things that have been said. Thank you so much, Dr. Korea Baran Mak, Dr. Korea. Nyakari coronavirus, the coronavirus achi tu tabi Gambia, achi mundu bling. And it's good that everybody in your own dialect hear, some of these things that are going to be said. I'm sorry that there's been some little bit of noise, background noise, but I think the essential message has been passed. And I just want to say thank you to all of you. And today also we have in our midst my own daddy, Mr. Vicente William Gomez. We've asked Vicente, who is a senior man in our society. He calls himself just the volunteer, a community volunteer. Anyway, he's not a community volunteer. Vicente would give us some few words of wisdom to anyone that want to hear us, and also take the moment to also say some few things in Manjago. So after we get Vicente, we will come back again to all of you. There is a question that we always want to answer, and that question is the role of the young people in spreading the COVID-19. The role of the young people in spreading COVID-19. What we see is the young people in our midst who are healthy, who may even have the disease, become asymptomatic, who are sitting in the bantabas, who are sitting in the attire booths, having their booths, not putting on their mask, and they picking up this virus, going back to their parents at home and giving it to them and giving it to their parents. And that's what we are seeing. And you would see a parent that has never gone out, probably that is sick. All of a sudden, the sickness gets worse. They get to the hospital, they test them, and they say that they are COVID positive. So I would want to come back to all the presenters for you to summarize those areas, really important, relevant areas to all, our viewers, to all our hearers, and also give your final thoughts, or maybe if there are things that you wanted to say you never said during the first time, you can take some 5 to 10 minutes to just summarize that for us. So we will have humble Vicente on. Most welcome, Daddy.
Hello, doctor, are you hearing me?
Yeah.
Hello, doctor, are you hearing me?
Yes.
Hello.
Yes, I'm hearing.
All right. Thank you very much, doctor. Let me unmask myself. But I actually kept this to send a message. And you can see the message on my mask. Let's save lives by wearing our masks and following the laid down precautions. Baramaka, Dr. Jabang, Timpa Timpa, Dr. Isaac Jabang, Unetanki, Dr. Green Harris, Armando Baramak. I was going to be a doctor for 20 minutes when you were not on. Baramak, Armando, undalilandre de mak yende ba doctor ne banyambi kimbebeki ka koraba English ndi chukum frontline workers. Mak kajati pa chibra kichi achi wanya ka tukari pina doctor o nyani me achiri lockdown. Kuinne balon kati mak balon ke bandi lockdown bekana mak muntum uchi barukati bat. Kombim jabu corona abandari umundu. Uleru check gronja atanyiri bababu wa chip mak bababu ba afwe bandri gambe ti bachu mal fiar ne a chip mak banyan kombo banyan banjul banjum kri ren fiar ne mak pi a chip mak pi me mo bora banyan bling tu manjaka jabukul na doctor John Kenya mijo wi jeje bukobi kim jeje bukobi ni wulerwi mais sympathie donc qui mat ma kuine bu ko bina docteur ko wulu bala ndu wulu ko katanu lief ka witi o parir nurule wulo buko so chi buko corona nete chi abaja nya punyo nya guichel jaka jeji kanya jaka roen ni futu face mask tinji gumuntu bling tu achi prescription ka korwe english achi kwas buko bi membu kuban lotanam ka be burure om ka malaria bolu buko malaria paracetamol bujo jajang kitabufa kitapnak kitabutakala chumbut uchinyang ngale corona di pulo banya ko geba pimba ngungu banya pro banya karo kongo matu so angal pinyani ndi bling tu banjaku ndi bikime kinda tema jaku te kuruki batmak uchingi fiar ne bikime bugun kuchu ku developta joku ngabande mak matu nyepi bu temple bu choka ninja te banya ba muntu kun tandi nata bu bajanja da jampusa te jeje ni koy du turis nimtem ba chuma la japu jeje koy bu tunari bu jok kuine bu joku muntu chitubul kay chedbo chitubul kanyakambo so kuine uchimtuna bu ko be bu jok api topri bu jok am turi bis nimtem njeri bu topam bis nimtem so pinya mag bi ku tupun ki kanari me bi ko kim tikon so angal pu barani de mag jakaru ki bat mag gruki bat corona ka corona series ndi corona ta bitew ndinga bling corona ta chun nori bandi te corona kuru nori ba chumal purat piang lemp kulbe ba kay piang ba chumal le ba dipiti pi kalbe kuine ubon ke bandi ubon muntu chun corona ta ubon muntu katumba chumal bi ka prir ka ko me bu ka rewul le fukul ka kak bo kakbi so kuine bi mak fa mak muntu me boflan ma ko bon so uchibim kam mak am kakam kap ban lokta bitam ko cham ki ro so group ki bat uchiba nos ni ba doctor janja da ron ko yi jaro ko muntu ci ko asu cin tiji malaria or paracetamol ba jojje jang te bu fa ke te bu nak te utakala ku jeje ko muntu ngaki yes uchiba jonyo ninya te jam face mak nduital kroko ron ko ba jong aci ko prescription di bawdo don ko nyani me tije malaria donc docteur Jabang ka manata tamburo mi ci tebro
Baran, Mark. Wonderful words there from Daddy Vicente. I can pick them now. I've forgotten my little Manjago, but in this series, I'll have to learn some bit of Manjago and get back to it. Baran, Mark. So we will get to the final words of the presenters while we look on our Facebook Live and also look on our YouTube Live to see if there are questions for them and they can answer those questions. So we will want to invite again Dr. Margot Green Harris. If you have final words that you want to emphasize and also answering the question of the young people.
Underlying medical condition back like a cardiac disease, asthma patient them. We don't see say this sickness here, so it can unblock them bad one. And most of them critical case where we can see. Most of them we can see say they can end up for go answer the maker. They're not but maker they can end up for die. Now them person here we get that kind sickness here. To them young girl and then young boy. As I say we dinner we days them. As I say we strong. And by God in power, we body go for conquer this sickness here. But do ya make we remember that mommy and that pa, that granny and that grandpa where we left now us. Their own days don't pass. Them body not tranga again like how we own tranga back. They no go, they no come. So make we remember that if we come out, make we get them in mind. That keep comping where we go keep comping. That tell body cushion where we go tell body cushion. By God in power, if Corona done, all them things able for be. So that go where they go na ya, come where they can na ya, go bend elbow ya, go keep comping and go rub body and do ya make we remember them. This 10 years so now we get for protect them. Then don't protect we will be picking. Then don't do a lot of things for we. So make sure say all them childhood sickness no me over affect we. And even then tell we did then stand by we. So now we want them to make we have that mommy and that pa, that granny and that grandpa where we left now us. I know say I know we got the time for talk again, but till the next time we go meet. Mina una sister and una picking Dr. Margot we can keep company una through the platform where Dr. Jabang organized Coronata series. Una thank you, una kushe.
Una thank you, una kushe, Dr. Margot Green Harris. Thank you so much. Like I said, you get a special prize from me for rattling the Clio in that way. It's very, very good. And Dr. Margot said a very, very touching point. Our parents were there when we were helpless. They stood by us. They made us who we are. And today they are old. Their bodies are weak. Old age has, engulfed them. Diabetes, hypertension has affected them. What is the best thing for us to do? Is the best thing to just go and bring coronavirus from the streets and give it to our parents for them to die? That is really not the best thing to do. And when she said that, that was really, really, really touching. And I hope the young guys, the boys that go around to the VOOs understand these things, that we are risking our parents' lives, and we are risking our aunties, our uncles' life. And some of us, our livelihood is in fact dependent on them. So if they were there when we were helpless, they took care of us, nurtured us. This time around that they are not strong, we should not be doing the reverse of what they did to us. Thank you so much, Dr. Green Harris. That was wonderful. Dr. Korea, if you are
You're
here,
welcome,
just give
sir.
us your
My
final
pleasure.
words and also give some strong words to the young guys who are going to the VOOs. Okay, all the VOOs where we put the 20 liters and we are all drinking together. Coronavirus now is telling us that this is no longer the time. If you want 20 liters, go buy your own 5 liters and drink it at home.
Dr. Jabang
All
Baram,
right, Dr.
Kadian
Korea.
Betinji, Kadian da Baram Betinji, Limba make a chili pichicumba, a chinda book in the time that Makin, Dr. Korea, Tunti, Bichiba making Dr. Jabang, teaching Chi Coronata to it, Majakan Chung, Kamufa Bandi. Kadian Litimji to a Michum Pitin, the Baramak mind that keep out of it. Uchinya Nam do to fear the Corona chi, come in near chi. Ndiko imbu kite numundu bling tu angu poka jaka dichibling banyak kata dege ayat nati Rome unchi na ucha to men banyak kana buju Saudi Arabia banyak ayatu tuwano amfia buno ontaparta jaka meni achi jakriki batu fetma ba me kunga chi pass ne upatu katang par banyak ne ka jako chi ma ka tafal achi ba tafal tu e paro minetero ku bukulia kadete ila te buta jakriki batu fetma Banyambu against Arvanjak were making Kayang Longichak, Bo Mekaya program. Jan could dare to Tengal Casama local with it. Gino Koyabugabuti epitome. Jaka Joko folk Rikibat of it. Parbuma will particular low with the Kero Loco. Mauchim yun to Kirnanani, Ulia Fulila not Pivichu, Kutu Lubiro Teno. Tiri me to a good Karakajanyam, Tija no Yan, no Liaf Kadewan, Kruchan. Kuinulia dudio blingulia fuyeka akang numar nga gatef ka tawrin ko ucho ulo le chite ko ngitab na kanya 1025 mpul purungul o kabiri o kalentu ko am kai pro kachibu di nyamba nyane ka ko fo ka yalo kita muim bija daga tumen ka corona banya ka te dira yalo kita ka je banya fo yalo chin to le fite ni sa ka te kata ka banya mu gi jot la le ko kanya ka stigma ka ke man corona Corona jindu mundu ne patija tu patina kitebu ne uchimma kulong chuma tu paratu man kati banko me ngam na corona tichi corona kulong kiti ma me pul chungkana uchim te kata le chungkana chulu biro pul batu kuim bajuma jara jaga kama buka bik o buka ni ram buka bim te bun kata mchibu di butam pul bano parwim te pat buchunga tem len tat 101025 nim duto ko Ntepano kumal tibanya karudena tibanya butam bokol ko chuan te ki butam pul na lona men ulia fulinchat tenon no pore tuba biro atintinye Dr. Margo nyakan titi aku no jago nyande ngri kuti bato fe jaga juraru to ba jiginja par bu kunja batin da tenglingi man fe arbutu ngi kabutu ko kakambutu ko durwana jaka juraru ko bu ko to kapma par burum ba mo na ta fal bu ka kumin jaka ngi piang ngai ti pete ivu pi kayang bar ki pete bu cirul na ba nyantem tigat mas ko miang guru ki sandol kan yetin jika jen da bara cinji Dr. Korea kak tibulai corona nata da bara Dr.
Okay.
Jabang.
Dr. Korea, Baran, Dr. Korea. Again, the emphasis are there. Young people protect the elderly. Let's protect them. Now we would have Dr. Isaac Jabang. Dr. Isaac Jabang, afaso kuna nasimchana fiyo epukia pakonga ka etisate ya pakonga full kehinwaho wa pakonga jobi ke kunyu katinyi hambodi naning ke gunga ngige kuyo kan hambodi Dr. Isaac Jabang afanyo boni pom hilim na fula lompo to konal po chempe san lompo hilim en kameni kitna no le fie anu wan katim posi janning programme yefe Dr. Isaac Jabang chuana nuti programme ko tek
Dr. John inti ya yukachen pada sogi timpa pada sogi lomba timpa ko mke giga Dr. Margo Paris Dr. Armando Korea Mr. Vicente ngamen ni atena lomba kilen kande ko kubarga ku emen ni ufu continue lo ngolo ko punu ke no job kati ko no bu ka ku nyenge ku emen ni eta pa edi hinom honol tiwati honol ku jamen to emen ni ufu ke kadu ku padayo wanu la fi so kala ma ka pangan hilim hayet men ni no one fear a chok ning a chok lit pina kada go nga go nyang le ha le fa ka kelante ho jano fu ke dalo ti ke inen ko tange nem ni nas njana ka kunyange ka kunyu ka gamen ni una pulo ngenia ana kawo na ka dipige ka kunyu ga ka kunyu ga anna job ko dula yo no apito sanko ko to lakena tempo ne no mi lola dunia fani en fio ka birin December pike for the August September ya nuna ka fie kim jama dunia ne pan avu kulindile di to present magani radika kawol pagati business men ni billion pm on business to kawoli fie plonjo anona beta ga dogo ne fasenge fie dabale da ko ekne fi sen nin ko kunyo ke gamen ke sempe member teke yo kane dunia ya inju ka fia we manu nyanga hinu diga kunyo at least tata kwa ho menu no na o na fi plon chao minji na o mo awe hin o mo kasua na hino mo no wan kuna na yang kan fango to kunyo ke fuko ekne yem fie na soka ni mata ko haje di tigidan dugare ponket yeno temo ni ma ata ko twa we choku ta ko wa meni we meni fo akai na kai omwa maybe anatali warande ko sifa ay num ful wa ni mata ko ku fe blon chaw dugare an no one ay no temo wa ne da fuka yi o fianji ne da fuka yi ko hin da fuka school kin fuka yo Isaac le ba waran fuka yo John le ba hani ni fa ngam nyan soge ke len ki pade ngura jefe soge ko luma ponket kai no pada kar ko na no wane ni apato ko kundi ko fu yang ngandula ke papa isibere knem na so kai fulu waso masketi masket kimbutu asojala porque ay so waranda polisa pete ol na warante paramete ka pete nawe an fi chok ning kuyeye nti e fans elonge tom ci yake ka to waranda ga ko kunyu ga admi ko kunyu ga bu mesge hin tawe so ano wande so ge fulu du kare waso masketi e ko putomi le kupsini ancho ay ni fangi tankande na fula tigidan ka jina na so ga ki di next so ndak tisu paper ki humte yo wante pae nata ko tisu paper ki humte pesi em ngone fie yo pesi wati wadi antakani no fia na liga wa tigidan fia yo pesi na fini ta ko hand sanitizer nem mane man ngai mo skor af ma mo si pesi fia me rada alcohol te yo kawo ne opano pan chuki ni mala liga likwa ma mo le pesi yo plon chao pour apian kangan fangi aga di faktiga kunyita wani an lomba ka fa chukin ta masiran jin sogale mana juga abadu ki humwa di war warande ini no pat pasen mi buem kala ngade ko warande ni yo be sowa warande na hangana wa aminto pume warande na nga wati le lu fi atimi mana ngami chamban warande anya sugulo warande ndak peci de ka songo warande ndak anteno banga meni ko sumayo dan ka ko hijumpa kan ngate keteno te ekna lu wati on so so yo timpik kan ane kunye teno fa so ni ejile fitu yo dotlo tan ka jande ka so ni corona na tage corona wa do meni putum paga paga so mamputum ba pita ho man ane na pu tempo na dago hani di fa ta dago kunye ke wai teke in fuke no kupada e kuye ke kunja ekna do antimpa fe antimpa jok fango teno na kunya ani na kunya warande dago humpo di kunye teno dukare nyema ta masire ni fiketo yonkal 1025 1025 na yonkala om number ifta panga ifika yingi ifika sogi wa ho nyangi him na ina dita ko om number inchukni ano pateno e kunye warande papa de kunya kun timpu sok nu chokyo le timpu le fiti kada ka sok ni corona na dake timpi chon ani apiket ticha ja wala mal le fi dunia beni wa hana dake hani ka kunyu kom na daga malaria fanga fatlota nyama ano bado ko mane dake ki ka kunyu man diabetes ka wade fi na kun dukare ni chopot lota le hangay kolalu kapuchuko anjo nif ka kijo hepun nif ka ino test ka bi ki corona ka ino test lambo hikelan he kine ning apuchuk ka kunyenge ti pakan gambe ne kadarak man pislo hisim para nega ka kunyi ke sokolo para nega ka kunyi ke asma kom ki susfia warande hampo di nyafia pa kom ka hang ko jogen ki yokan warande ko no mi lo ha poni una youth here especially carbono e mata ka musol kay ka le dungu kay ko le lan wate ya anna nyongol piano abuso elane hinan cinta ke ko lana hani ka to tompo loni ninji fengo angena lan karina lan ni ma ono da corona alu fi plon chaw ndigeni take talu bu fondinge maybe ete yo kandi maybe ete moki why na mi lola nji kay ka le lungenke yini chopi corona nke 10 of mama do mata obato maybe choli of mama na ta ka ka kuni na ket af milol pume elonge de fega hadi ke nine af milol e chone mama to na ket tempo ne tanulo ngata ko maru ko fana so ka to no ngata fofu na ka te no na ke wa ho wa anyi dun ka kunyu he joplo tan fi plon chaw kan na fo fiola no yamale wodo fio afonding anyan kan pakani ke mtemo anyang e jogo koti pour awela may domber pour signay pour papai pour asomi min pekasi una fi plon chaw pour mama yi fi plon chaw kato ko hampodi na bana ta hang nuna chokol fanguna ko ka panopan ko ba he moko nyombo nya bakatuna te una kalo no ra nyombodi fan payam pa fi na fina ono la ma fi te hampodi na bana pesade hampodi na bana kalo hekela na hekena yem nuna ubina kuye fi plon chaw ko fitanola o fu yang kan na fan hekela na ganjif sekni lon ala fi atio teponi why wate e pole fi ati ekne yem ning timpu kai ti hangitan timpu kai ni ane kunya ano wan timpa kai hiyo kado kana no na kai hiyo ano na chupi ka kunya e ti kan kanuna warante ke ngot ano na fulipu kalon ani na fulipe gambi panopan papa nga fulipa panopan chiti wa nuna yang kan na fanguna nyabo na fakapa to kwoto le fu sintenale u choka wotu na mu yani kuye e fimbe mus nuna u yang kan na fanguna at least no wana hitu nyobo nyobo na kem kale ni kuye musa no wana hoti elonge dio fana mfu afia kulunde afio le fana le hilem han sokala ala baraka lo kis ne ka panopan di dunia e no sokala ni fu ni hodi lokun te ko badenge mi be ngata ko wade diga siden wade fia pedi jimbo ay ni siden record sen ni do ka jon ni hanno hilem abaraka
Isaac timpa Dr. Isaac Jabang timpa hilima chukam ni lang chubi la hilim ha toko fanu soka fakalon kala fuli la fuli andu on peut le fifio ne le fia awi le fio katim pala ko ngot wa we menwa fanu ka hinu tun ko la lamba nin ke ngot kitakia hinu teri dunia ya pulon katim peke uto pa fia pakan dantang surtout pakan baka paen kam meni kata bukulu ni humbotin tuna kayano saw yitom pige ba ansisi humbun na soke yo timine meme njiyam to ko humbudi yo ninji kayu me wo me pakam bagay fukaso ninji kayu me wo me fe wani ku tola tol di jamane ya meni eti so ko teke ni anu wana fa kay panu wana fa kay panu panani saw yitom bare ke gunyu ki jobi wahem woto ano wan awase hete kunu woni uyankana nula nuna nuda fo ke gunyu ka efu yo kaluna mema andum wate feke nuna huta e pa man kasoke ha ke gunyan ku efu yo kaluna mema aza ka soka sok wa jama leye ke gunyu ka kijari tisu pakamba ka fie nka susu ke gunyu ka munta ning anataka o ke gunyu ka munta we man manate nyale tenyal mana we wa hani ke gunyu ka kijari tisu ke gunyu ni ke gunyu dorom nata ka ko pakambang ka me ko juna tawe pakambang ka ini kayangkan barnata ka ko awe ada ke gunyu asu at soko an man anne ani ada ke gunyu o mana na keti o ke gunyu lefi pakambang dim ka me ni o ke gunyu ni nakanol fi la pakan fangol la man yo kan andum lompo pakan pakalompo nu fan lompo ke gunyu ke gunyu dorom anu wan kadim pa ko. Thank you so much, Dr. Isaac Jabang. I mean, Isaac made some points that are very, very relevant, and he talked about the fact that people now are ashamed of even having corona. So there is a stigma that is attached to coronavirus, and because of that, when people's relatives die, they don't even want it to be tested. They quickly want to go and do the burial. But in doing things like that, we would not take the necessary measures. So corona is not a cause, and that is going to be something that we will discuss on this platform, the misconceptions of corona, and we will try to explain to everybody that corona is not a cause. It's a disease like any other disease. And I want to say thank you so much to Isaac. I realized that most of the tribes, Karoninka, Manjago, we have 2 people that are speaking, and only Aku, 1 person spoke. And I have part of my in-laws who are Aku, and I don't want them to say, well, again, you came here and you sought us. Aku, only 1 person spoke. So we're having Dr. Kelvin. So Dr. Kelvin Thomas, can you give some final, it has to be balanced, yes, it has to be balanced. I don't want anybody to say, well, okay, Dr. Jabang, we see you are Karoninka, so you've given Karoninkas more time than you've given Manjagos or Akus. We don't want to get into that fight. So Dr. Kelvin Thomas, if you are on, please, can you just come up and say some few thoughts in Creole? We do not have any questions. The one that is watching Dr. Damfa is the one helping us with the Facebook. He sent this. He said, "Timpo timpo pakanam hataya." This was sent by one Simon Jabang. So Dr. Damfa is asking whether that was a question or not a question. Dr. Damfa, that's Karoninka to say, thank you so much, my people, the Hata people. We are from the Hata clan. It looked so funny. But anyway, thank you so much. That's fine. Dr. Kelvin, you most welcome.
Hello. Good evening. You hearing me? You guys are getting me? Okay, sir.
Yes.
Good everybody. All the way from I want to appreciate Dr. John Jabang for this vision here, so we get this Corona series here. So a team we really good. A team we come for help help the country, as we defeat this coronavirus thing here. So I want to also say thank you to all the panelists. When I don't talk well, I don't do well. Wait, I want to talk now, just something brief. I just want to talk, say this disease here, so this sickness also coronavirus, now TWA preventable. Not TWA, no say we not get means for able for protect yourself or family them from harm. Now TWA preventable measures, then they talk about the face masks, how important in be. Don't talk about the hand washing, the using of the sanitizers. Yes, the use of the sanitizers, like I say, not preventable. And get one thing we can talk to people in a BM. We can always tell and say, where person gets this virus here, so especially the young one, they don't know to say about, let's say, more than 80% or 90% of all people in a BM will be where then diagnosed positive for this virus here. So then at the asymptomatic stage, then they manifest any symptoms. And they all are young people, them, almost 80 or 90% of them all. So we don't notice that. So we can always tell them, say, this is a personal responsibility for let you and protect your family member then, protect your people then. So where you then give, for the on self-isolation, not a time for me, you just do anything you feel like for do. Like we talk about, Dr. Margot, don't talk about say we get old people there within our house. Then we family there, they will, we granny there, they will grandpa them, their mama and papa them, they don't get maybe diabetes or get asthma or then other chronic illness. Now we responsibility for protect them. So we then young people oh they asymptomatic. Not really time for more go na na bantaba, get one already, get funny incidents already, get one bobo no say, get the virus, but you always go to the field for go play football. You don't mind, you don't care, people you talk to them, but you don't mind, you go to the field, go play football, you go outside, you go to the bantaba, all take you talk to them. They say, so we the young people there, we get great responsibility. They say, now we able forfeit this virus here, so if we continue to be like a desical, this virus has to go for very long, and they want to our breadwinners them, Dr. Jabang say, some of we, and the people there they at risk, and they will depend on. If them get the sickness, then the sickness can disturb them just now. Now we suffer the effect. So now we responsibility for help protect them. So I want to tell the panelists thank you. I want to tell Dr. Jabang thank you. And all the ones they follow this Corona Nata series, I tell myself, continue for the follow them. Get various episodes where they come. And all issues that we get for do with this virus here, so we get for the land, all the land back more the share to with them. Opportunity for come join me, also or they on watch on Facebook, YouTube, they listen. So get information, them, we colleagues them, or pass the message to them. We will self-teach them. And to learn from here, we will teach them. So I want to all thank you. I want to tell John Jabang, thank you. Thank you very much, sir. We appreciate. And on behalf of the Gambia people, we say thank you. On behalf of BM, we want to say thank you as well, sir.
Okay, Dr. Kelvin Thomas, thank you so much. All the way speaking from Buyam. And your connection looks so good in Buyam, right? Almost competing the one that we are having over here in Combo. So thank you so much. Thank you. And just to remind the listeners, just to remind the viewers that every Friday, same time, we will have Aku Manjago Karoninka presentation on this platform. Every Friday, same time. And every Saturday, same time, we will have Jola, Sarahule, and Serer. Jola, Sarahule, and Serer. Every Saturday, same time, 6 to 8. Every Sunday, 2:30 to 4:30 p.m. Every Sunday, 2:30 to 4:30 p.m., we will have Mandinka, Wolof, and Fula on this platform. We intend to keep this as long as COVID is with us. And obviously with time, we will also be talking about other things. And I just want to say thank you to all the presenters that have presented today. You did a fantastic job. Dr. Marco Harris, with his backup, Dr. Kelvin Thomas. Thank you all so much for speaking in Aku. I do know it's not easy. We have attended school and we have gone to school. We do most of our presentations in English, and coming back to really present in our own language, local languages, is difficult. And I can understand how the big stress that is there, but it's a worthy cause that we need to spread the information to our own people. So thank you so much. Dr. Armando Correa, who's been working throughout, and I said, well, you must present today. Please help us that with the backup, Mr. Vicente William Gomez. I want to say thank you. Baran, the first people, thank you. The second people, Baran. Dr. Isaac Jabang, my very own brother. I just want to say thank you. It's amazing to be here, and thank you so much, Timpo Timpo. For those that presented last week, we had a small surprise for them, and I just want to share my screen and show it to them, and I will tell you all that no presentation is going to pass unrecognized. We will try to see if we can recognize every other person that is going to present on this platform. So let me see if I can just show you a gist of what we have. So I guess you can all see, and I want to say thank you to those. Just a second. Okay. So the first certificate, we will be sending it to Dr. Musa Marena. That will be followed by one that is going to Dr. Ali Sen. And the other one, Dr. Binta Musa Marena, and Binta presented last week for the Mandinka, and we want to acknowledge them and say really a very big thank you to them. Dr. Ali Sen, together with Dr. Pa Amadou Sohna, you will see also presented last week, and we want to say thank you to them. And then Dr. Chernova also presented last week, and we want to say thank you to them. So these are a few certificates that we basically want to give to them, and hopefully those that have presented this week, by the grace of God, if we all witness, obviously next week, we will also give you some few certificates. Yeah. So having said that, I just want to say thank you to all of you. Thank you, Dr. Lamin Damfa, who's been on our Facebook and on our YouTube, trying to check the comments. So if you have comments, if you have questions and you're watching this program, you can always send those comments or questions on the Facebook or the YouTube, and we will get it to them. For every other person, I want to say thank you, happy weekend, catch you tomorrow, the same time, the same place. I don't know if it's going to be the same place or not. Same places, right? For Jola, Sarahule, and Cyril. Okay. Thank you all so much. Bye-bye.